start recording. Good evening, everyone. Thank you for joining us this evening. The purpose of tonight's presentation is to educate you about breast thermography. And in this very short slide presentation, we're trying to keep this to 40 to 45 minutes. I'll be able to show you before and after thermal images of women who have reduced their risk for breast cancer and share with you some of the things they've done to reduce their risk. And this is what this is all about. I'm going to start right now with just a little bit of my background. Gaye Walden, I'm a holistic health coach, and I was trained by Dr. Bruce Wren about 9 years ago to do a breast thermography. So I opened my business in 2012, and so I'm going into my 9th year of offering this service in the Charlotte area and in North Carolina. So because I became a health coach before a thermographer, I've incorporated in my service, not just doing the imaging, but I incorporate a health coaching session after the thermogram to go over the report and most importantly, share with you all the things you can do to affect positive change. The reason that thermography is not accepted as widely as we would like, and of course, most insurance plans do not cover it, is because even though it was approved by the FDA many years ago, it still is not, it does not diagnose. And the screenings with which most women are familiar are set up to diagnose and treat. Thermography is to give you a heads up. It's a risk assessment screening that gives you a heads up like a forecast, so that if the forecast is not going in the direction that we would like, we have the ability to reduce what it's looking like and go back to, if you want to use a weather forecast, sunny skies, because if the clouds are imminent and a storm is imminent, we got to do something. And once you take proactive steps to reduce your risk, we can go back to sunny skies. And this is happening every day when women are using thermography the way that it should be used. So I'm going to start with showing you what a color image looks like when I take a thermal image. And the reason that color is so important, it identifies heat patterns. And when you look at this rainbow or false color image that I have on the screen, actually the entire breast is mapped out, with the warmer areas in the breast being indicative of, if it's not trauma or infection, it's inflammation. And 9 times out of 10, we're dealing with inflammation. Let me explain the color scale here though. Look at the color scale on the right of this thermal image, where it says 27.5. Right above that is the black. Black is the coldest color, white is the hottest. As you go up the color scale, you're talking about a very minute amount of temperature difference between these colors. So that's how we're able to map with the color. And if you look at this particular image over the right breast, there's a circle, right? It's in green. And the opposite breast in that area is the light blue. We have measured that area to see what the temperature difference is. And temperature differences are one of the criteria for risk assessment, because we follow certain risk criteria to determine if you're at high risk or low risk for having breast cancer. The scale is TH1 through TH5. TH1 is below average. Average risk is 3, and above average risk is 4 and 5. And we have set criteria for those particular risk categories. And I'm going to show you women who have all of these in this slide presentation. Now, another way we look at these images is in grayscale. And a lot of thermographers do not view the images in grayscale. These images in grayscale or black and white are used to see what we call thermovascularity. When you look at this particular grayscale image, you will see I've put a pink line throughout this vein. And what this is a blood vessel or vein, because this is a surface test. It does not go inside the body like radiation. It simply images the surface of the breast tissue to determine, is there infection, trauma, or inflammation? And like I said, 9 times out of 10, we're dealing with inflammation, and we know we can reduce inflammation. So when we look at the grayscale and it starts branching, and that's what this pink line is through this particular blood vessel, it's indicative of what we call thermovascular branching. But these blood vessel patterns also are one of the criteria that we use for risk assessment if we see certain patterns, because we've seen a lot of these thermal images, and these patterns start proliferating and the shapes start forming certain shapes, it definitely adds to the risk. One thing that's important about the images when we look at them in color is that the breasts have symmetry in color. Do they look alike? This particular image is of a woman who has great symmetry in her breast. You can see that the right and the left breast, by the way, when you look at these images, the right breast is on your, the left, the woman is facing me. So the right breast is on your left and the right breast is, it's opposite. And a lot of people get confused. But in this particular image, both breasts, and that's what we want to see, look alike from a color standpoint. That is indicative of healthy breast. Now, this is an image that shows asymmetry. This is a very extreme example of asymmetry. And the brief story on this lady is she had breast cancer. She was curious about breast thermography, which a lot of people are. So I took images of her right after she had had a mammogram. The mammogram was clear. It said, it was a normal mammogram, but she had a history of breast cancer. So what that normal mammogram meant for her and means for her is that, and when you get a high-risk thermogram following a normal mammogram, the high-risk thermogram indicates, even though the mammogram was normal, there's indication of inflammation in the breast tissue. And it's only a matter of time when perhaps if she doesn't make changes in the way she lives, and this is about lifestyle changes, taking preventive steps from a lifestyle standpoint, she may get breast cancer again if she doesn't look at this thermogram and realize that my mammogram is normal, but I have a high-risk thermogram. I need to do something so that it doesn't show up in a mammogram ever again. And that's our purpose with doing thermography, so that, women don't have to, somewhere down the road when they do their mammogram, be fearful that something is going to show up. By doing thermography and keeping literally abreast of what's going on in your breast tissue, you can do the right things so that never anything is going to show up in a mammogram. And that's what we're trying to accomplish with thermography. It's the right way to use thermography. So now I'm going to show you before and after images. So on the left hand side is this particular one with high risk in both breasts. Okay. And in 5 months, she lowered her risk. And I want to, you can see clearly, a picture is worth 1,000 words with this. How you can see the warmer colors that I mentioned, yellow and red. There's definitely more of it in the left breast, the image on the left-hand side rather. But look at the image you see on the right-hand side. Do you see how the symmetry and the cooler colors are much better? So, what does she do? Okay. You have to take an overall health approach. It's not specifically doing things for the breast, but 9 times out of 10, it takes lifestyle changes that address overall health issues. And this particular woman had high blood pressure. She reduced her high blood pressure medicine. She worked with an alternative practitioner. She improved her thyroid function. She removed parasites. She balanced her hormones. And in 5 months, she was able to reduce her risk in both breasts. And this is what, it usually doesn't happen in that short amount of time. Usually it takes at least 6 months when a woman is deemed high risk, at least 6 months. And that's what we recommend before she come back and re-image. And I never want a woman to come back unless she's taken some proactive steps, because the thing is, if a woman does this and she makes no changes, when she comes back, we're going to see the exact same thing that we saw in the first thermogram. And that's not what this is about. We want to see positive change. And in the 8 years I've been doing this, many, many women have affected positive change, which is telling them I'm headed in the right direction. If I continue to live healthy as I am and incorporate the things I've been doing, my breast health and my overall health will be good. So here's another example of a woman with a high-risk thermogram, which is featured to the right-hand side. That's the high-risk one. The one below, she was a TH5 in the left breast. Can you see the asymmetry between the left breast, which is, you'll see on your right, and the right breast? You can see there's an area of warmth above her left nipple. And so this is a health coach. I get many, many healthy women coming to see me, and they're on the right path as far as eating. And of course, I'll show you later on images of how important food is in all of this. But she was doing some things that it made her realize, okay, what am I doing in my lifestyle that I should stop doing? She was swimming in a chlorinated pool every day. She stopped that, and she had some structural issues she addressed. And in 4 months, she reduced her risk in the left breast from a TH5, it's the highest risk, to a TH3 plus, and that is record time to make that kind of improvement. Here is another woman who incorporated breast lymphatic massage. She didn't do it right after the thermogram. She waited some time before she decided that she would address the lymphatic congestion that 9 times out of 10, that's what we see that creates inflammation. So doing lymphatic breast massage is probably the key thing that women can do to affect positive change, because most of the women who come back, they incorporate that, and I want to make sure they incorporate that. So I refer them to Effie Sperlin, and she's on the call tonight, and I'm going to refer to Effie to tell you a little bit about this woman, and also tell you about what she does and how important it is. Effie? Effie, we may have lost her. She said she was having computer trouble.
Can you hear me?
Yes, there she is. Good.
Welcome, guys. It's great to be on with Gaye tonight. Our team is very effective for many, many women. What this particular woman did is she came to me after the thermogram, she came to me for some breast health education, and I helped her learn how to do breast massage on a daily basis. And we also did some cupping on her breast tissue to increase the circulation. And over a period of about 4 months, after coming in weekly, we were able to, number one, with our breast health education piece, help her to identify what was going on in her breast tissue so that she could monitor this as she came in for care and did her massage every night. She was able to tell the difference in her tissue getting softer and softer and softer. And eventually she went back to Gaye after, I think, maybe 4 months.
4 months.
4 months. And the thermogram changed tremendously to a healthier stance. So we were able, with manual lymphatic drainage, breast massage, cupping, and her understanding exactly what's in her breast tissue through our breast health education process to improve her breast health completely. This is what we see daily with our women. Back to you, Gaye.
Lymphatic massage is extremely important. It is a common denominator for good breast health. We've just seen too many women. This woman only did lymphatic massage. Just suppose she had incorporated some other lifestyle changes, made some other healthy habits, we probably would have seen even more change in her thermogram. But to have this one thing in 4 months shows us, and you can see by that image that I'm showing on the slide, the right slide there, you see the better symmetry, the cooler colors in each breast. Breast lymphatic drainage massage works. And one thing Dr. Wren taught both Effie and myself, because Effie and I've been working together now these 8 years, is that he says, Gaye, the hands-off approach to women's breast health is not working for them. That means they literally have to get in better touch with their breast. And we have held that in our heads, and we've promoted it, and we've seen how effective it is. And so all of you on this call tonight, please urge women in your life who are afraid of getting breast cancer, and the fear of it is epidemic. Let them know there are things they can do as simply as getting in better touch with their breast tissue. Thank you, Effie. So here we go as well. I want to show you significant improvement in 3 months. Again, showing these before and after images and sharing with you what these women have done, hopefully will make you realize how this should be used. As I said, a lot of people don't use it as risk assessment, and they use it as as a diagnostic tool, but it does not diagnose. It just gives you that forecast. But in 3 months, look what this woman did. And what she did, she worked with an alternative practitioner, She changed her supplement routine, but she had the Epstein-Barr virus. And through working with this alternative practitioner, she suppressed the Epstein-Barr virus, which a lot of us have in us if we've had mono. And she lost 10 pounds. And in 3 months, she went from what we see on the left-hand side to what we see on the right-hand side, which is incredible improvement in 3 months. Here's one in 1 week. Now, this is very subtle. You're not going to see a drastic change in these images because thermography is subtle. The camera that I use is sensitive to 1/10 of a degree. So, a 0.1 makes a difference in a thermogram. But this particular woman used far infrared therapy. I experimented with her with a machine called the Photon Genius, which is like a far infrared sauna on steroids. I gave her a thermogram before she started the therapy and after she completed it, 1 week. And in 1 week, she reduced her risk by 1 point. It's very subtle, but look at that left-hand side image here, the red, the more red and the yellow, and you can see those colors are subdued in the improvement image on the right-hand side. I'm going to show you her images in black and white because remember I was talking about thermovascularity. Well, this is an example not only of improvement with this therapy, but this is an example of someone who has extreme thermovascularity. Look at the veins that show up in this thermal image. These are patterns that we don't like to see. Unfortunately, we see it all too often. And when these particular veins start forming these patterns, we don't like it. The forecast still needs a lot of work when we see, and this woman comes annually. She's a pilot. She's an airline pilot, and she knows because of her career that she's at higher risk, so she keeps up with her breast health. And I can tell you one thing, she does this far infrared therapy all the time because she's seen how it works for her. So here is an example. I don't know if you know anyone who wears Spanx, but I had this client come, and the image on the left-hand side in this screen on this particular slide was her second thermogram. Her first thermogram looked more like the one we see on the right. She came for a second one in May of 2017, and I looked at it and we went over it and I said, "What have you changed? What's happened?" And she says, "Gaye, the only change I've made in this year since I've seen you, I wear Spanx every day." Okay. I said, "Please, please, please stop." And she did. And she came back in June of 2018, a year later, and her thermogram went right back to what it was initially, which was a good thermogram. And with this in mind, I want to reinforce, like I just reinforced with Effie and how important lymphatic massage is, that structure matters in breast health. That means any kind of structural imbalance that we see. And sometimes when you wear something that restricts the rib cage, obviously that's going to impede lymphatic flow. And this is when I want to introduce Dr. Hans Van Huel. He interprets my thermograms and he can give a great structural breast assessment. I'm going to let him address this. I'm showing this image of the back because I take images of the back. And the reason I take images of the back, sometimes this structural imbalance can be seen by the image of the back. The way she puts her hands up on the air, we can, behind her head, which she has to do for the imaging, we can see the structural imbalance. But this is what Dr. Wren says about poor rib motion, and that's what a Spanx does. If this is restricted, this poor rib motion means poor lymphatic drainage in the breast. We go back to lymphatic drainage in the breast again. But Dr. Hans is going to address this because he knows how to work with a woman to correct this structural imbalance, improve lymphatic drainage, and improve the breast of the health. Dr. Hans.
Hi, Gaye. Thanks for having me here. Yeah, so can we go back to the slide, please?
Yes.
Okay, thank you. So you really have to think of your body. Can you hear me? Yep. If you really have to think of your body as a house. If your foundation is crooked, your roof is going to be crooked. So if your pelvis is off, like it is showing here on the slide, it will throw off the whole shoulders because the head wants to be in the center. Now, what does that do? It throws everything off really in the body because the muscles kind of go in triangle forms from the spine to the shoulders or to the pelvis, and it overlaps the rib cage. Now, if we have a curvature like this, it reduces the amount of travel that the ribs can have when we breathe in and breathe out. It is so important that we have that rib cage motion because that allows for lymphatic drainage, and it helps. It's like a lymphatic pump. So that is really why we have to have so much motion on there. You can see in the color image that, there is quite a bit of a curvature. That's not even a scoliosis. Yeah, in the previous one. So, and you can see that the right shoulder is so much higher than the left. That can probably indicate that there is restriction in the right shoulder. There is a curvature in the spine going all the way down. So, and all those things have to be addressed to allow the rib cage to open and close equally on both sides. Otherwise, we get uneven drainage as well, or no drainage on one side and more on the other. So there are specific techniques that we can do, and these are all gentle chiropractic techniques to address the rib cage motion, starting from the shoulders down, but we actually have to look at the hips and work our way up. And that's just how we really can get to even shoulders and better rib cage motion. Thanks, Gaye.
Thank you so much, Hans. I don't think most people know anything about structure as it relates to breast health. So it was the first time I heard it when Dr. Wren mentioned it to me in the training, but structural integrity is very important. And Dr. Hans is excellent at addressing this. And I do refer my clients to him to get a structural breast assessment, and they do get help with this. And very quickly, proper breathing can help a lot. And, breathing deeply can help open up the rib cage, obviously. And a lot of us don't do a lot of deep breathing, not enough, right? And sitting can do it. Lots of things can create this rib cage restriction that Dr. Hans can address. Now, let's talk about hormones next, because hormones obviously factor into breast health. Look at this image. It says 2017 underneath. It's the one on the left-hand side. Do you see how in this black and white image, there's a polka dotted look? It looks like a leopard. This lady does look like a leopard. Well, this leopard-like appearance, when we see it, because we've seen enough of these images, is indicative of something we call estrogen dominance. That is definitely a hormonal issue. So when she came in 2017, this particular woman had been taking a new supplement. She just started taking it, and she didn't know what was in it, but she called me after she came for the imaging and told me that the first ingredient is soy. Well, soy on a regular basis can create this kind of estrogen dominance. It can promote it because soy is one of the strongest phytoestrogens. So many people who talk about women's breast health promote it. And some people like myself don't think it's a good idea, especially other than moderation with soy. Fermented soy is okay. But so she stopped taking that supplement right away. And she didn't come back in 2018, or if she did, we didn't see a tremendous difference, some difference. But in 2019, when she came back last year, between 2018 and 2019, for a whole year, she did acupuncture every day to balance her hormones. And now she went from what we see on the left-hand side to what we see here on the right-hand side in 2019. Can you see how things have cooled down? Those patterns have diminished and gone away. She has balanced her hormones, and I know that acupuncture can do that. This is my favorite slide to share with everyone because I am a holistic health coach, and I do believe in the power of food. And this particular woman came to see me in August of 2016, and she had a good thermogram, because anything that's a TH3, and a 3 is an average risk, but believe it or not, when that is stable, that's a good risk rating. Obviously, we'd love to see more women below average, and a TH1 or 2, obviously we'd like to see that. But when we see a stable TH3, that's good. So she had a good thermogram. And then she didn't come back until March of 2018. When she came for the first one, she told me during the follow-up session I had with her, she says, Gaye, I'm whole food, plant-based, but I'm not picky about organic food, eating organically. I said, okay. Well, in the time she that elapsed between August 2016 and March of 2018, she went all organic. And this is the only image, this one that you see on the right-hand side there, one of the very few that has been assessed the lowest risk, a TH1 in both breasts. But do you see, I actually showed this image earlier in the slide presentation, you saw it, but this is the best symmetry. You can see that the colors match exactly, and above the breast, which we consider above the breast, part of the breast, this upper quadrant, we don't see the thermovascularity, which some thermovascularity is actually normal. It's normal for some people, particularly above the breast tissue, to global breast, to have some sort of this thermovascularity. But if it's consistent every time she images, this is her, we've established a baseline and nothing's changed, and it's not bad at all. But I would love to see more and more women get to this place. But unfortunately, I don't see it that often. But the more changes you can make in your lifestyle, because breast cancer is not a genetic disease. A lot of women are led to believe that it's in the genes. And I think that's true for a lot of types of cancer. But only 5 to 10% of all cases of breast cancer have a genetic component. The rest, 90 to 95, is lifestyle. And we've addressed some of these lifestyle things in this presentation. But I also want to show you this, because we can't tell a person when we see an image like we see on this particular slide, the left-hand side there. You see where there's yellow and green, and it's going into the global left breast. We can't tell a woman that that's breast cancer. We can't see breast cancer. We can see inflammation. And hopefully after something like this, she will, especially if she feels something differently, she's going to correlate with other screenings, because every report that we generate says correlate with other screenings. This does not replace a mammogram, an ultrasound, or an MRI. Those particular screenings are looking for structure, and we cannot see structure. But this particular woman with a high-risk thermogram in her left breast went on after a normal mammogram, and she was diagnosed with breast cancer. So mammography is not an effective screening for women with dense breast tissue, and most likely she had the dense breast tissue, which does not allow the radiologist to see what they're looking for. And even breast cancer doesn't show up in a mammogram until it's a centimeter in size. But they're looking for, even before then, for little specks of calcium, and they cannot pick up these little specks of calcium with women who have extremely dense breast tissue. And 50%, up to 50% of all women have this density, and it's related to age. The younger a woman is, the more likely she is going to have dense tissue, but throughout her life, a woman can have this density, which does not make a mammogram an effective screening because they can't see what they're looking for. With that being said, I just want to give you a visualization of all the types of screenings available to women. Here's the thermogram, the mammogram, the MRI, and the ultrasound. The tomosynthesis is what you call the 3D mammography that's routine now, even for women who don't have dense breast tissue, and they slice through the breast. More women are having this because insurance will cover a 3D mammogram for most women, even if they don't have dense breast tissue. But the FDA approved it in 2011 specifically to address the women who have the dense breast tissue. And this is the visual of what it looks like in a mammogram with a fatty breast. If you look at that white area there in a fatty breast, that's how clearly they can see a structure. But here's the dense breast pictured on the right. You see how it's all white, and what they're looking for is white. So it's very, very difficult. Now I'm showing this slide. This is not from my camera. I'm showing this because my goal, our goal, is to get this in the hands of younger women. Obviously, younger women are not promoted to have mammograms for this very reason I just talked about with this density. It's really dense young tissue, and radiating young dense tissue is not a good idea, and especially if they can't see what they're looking for. But there's a rise in the incidence of inflammatory breast disease, particularly in younger women. And it shows up not as a structure, it shows up as rash. It has other symptoms. So, and of course, heat would be one of those. And this particular woman, which is, again, I've never imaged anyone who, this is somebody else, someone who works in California. The person I bought my camera from, it's one of her patients, her clients. So I hope I never see it, but unfortunately there's a rise in the incidence, and it's, like I said, doesn't show up as a lump. And so younger women have more to gain. This is good for women of all ages, but younger women have more to gain by at least trying this and to see what her breasts the health of her breasts looks like. So a breast thermogram is easy, simple protocols that you follow before you come to cool your body down. When you come here, I cool you down further in a temperature control room. It's right around 68 degrees. The images took no time to take after that. And then I send those images to Dr. Hans, and he evaluates them. And we usually get the report and risk assessment back in about a week to 10 days. Here's my thermography room to show you the layout. I position you on a rug for each image. This is the simple part of doing a thermogram, is following the rug where I have everything, or have you positioned. It's the 15-minute cool down that, that I get your intake information. It goes by fast. It's effective, like I said, for women of all ages, particularly women with dense breast. I image women with implants all the time. Women who've had breast reductions. Some women come after they've had breast surgery to monitor to see if there are areas of heat post-surgically that they need to monitor and address, because after a woman has had a mastectomy, this part of the breast, which is the lateral breast tissue and very important for breast health, needs to be monitored as well because of lymph nodes. So I do get women after surgery coming here. It's safe for pregnant and breastfeeding women, but I do not promote it for those pregnant and breastfeeding women because it doesn't give a true indication of breast health until they stop breastfeeding 6 months or longer. And then we can get a true reading on our breast health. It's simple and painless. And of course, the no radiation is what attracts a lot of women, and no compression, which I had a woman recently, I've had more than one woman come here, and they feel like their breasts have been bruised because of the compression. It is the only screening that provides a risk assessment for breast disease, which allows you to take a proactive preventive approach to breast health. I have 2 types of appointments available: a fully interpreted thermogram, which includes the 9 images, the detailed report, and the follow-up. And then something that I announced last year, which was not good timing, obviously, with COVID, is something that I have come up with Dr. Wren to educate women about thermography and to give you a glimpse of your breast health at a better price point. So you can make an appointment with me for a ThermoGlimpse, and you have an opportunity through a ThermoGlimpse to apply what you pay for that to a fully interpreted thermogram after you've been educated while you're here about what we're looking for. You can make that decision. But it's very important that women take charge of this, and thermography allows women to take charge of their breast health.